May. So welcome to the December Lunch and Learn of the New Jersey Doula Learning Collaborative. The NJDLC is an organization that exists by doulas for doulas to support the process, to provide the information, the continuing education, and the support doulas need to build a sustainable practice as doulas. And today's Lunch and Learn topic is doula work. How do I get started? Welcome to the Business 101 of beginning a doula practice. Next slide, please. So did you know that you can register any business name and you do not actually have to start a business? So first things first, what's your business name going to be? If there is a business name that you know you love, you woke up with it, you think, oh my gosh, I'm going to call my doula business Fuzzy Wuzzy Bitty Babies. Please don't use Fuzzy Wuzzy Bitty Babies because now I've said it. You can go on a website in New Jersey to search and see if your business name is already in use. We will put that link in the chat, Katya, if you would please, where you can go to this website. You can search for any business name and it will tell you, oh, that business is already in use in New Jersey, or no, that business is not in use in New Jersey. And here's that portal here in the chat, and we will make sure that that is in the notes as well if you're watching this on YouTube. So you search for your business name portal, and when you find out that Fuzzy Wuzzy Bitty Babies is not taken, you can go to this website, njportal.com. Oh, there's the business name search. You can go to the next website and register your business name at business.nj.gov. We'll put that one in the chat as well, where you can register your business name. From day one, it is essentially important that you track any and all business expenses, and that includes any expenses for creating your business. After you have your business name, you might choose to establish yourself as an LLC, a limited liability corporation. You can do this with the help of an accountant, or there are websites online that are many are low cost. I use LegalZoom. This is not an endorsement for LegalZoom. We are not sponsored by LegalZoom, but that's who I've used to create a couple of different LLC formats and have found that to be very user-friendly, very easy to use. They help file all of your paperwork with the state so that everything is done neatly and legally. I encourage everyone to use some form of business tracking software, whether you do it through your personal bank, whether your bank has an app that you can use for your business account, or you use QuickBooks, or you use Rocket Money, any of the apps that are available to track your expenses, to keep your receipts. And if you are driving for your business, you can also track your mileage. You can take a tax deduction at the end of the year of 55 cents a mile for your miles driven. So record your mileage. You can do this by hand if you keep a notebook in your car that you write down your odometer readings at the beginning and end of the trip, or you can use an app on your phone. I use one called Mile IQ, but I'm aware that there are others that are available as well that you can download that can track your drives that you can then categorize into business or personal expenses. And in New Jersey, side note, any mileage that you encounter for medical expenses for your own personal care can also be deducted from your taxes. So keep an eye on your mileage. Other business expenses that you might keep in mind, what are you spending on your business cards? What about your web domain? What about your insurance? What about your bookkeeping software? May I have the next slide, please? After you've established your business and you've opened your LLC, you've established yourself as part of an agency, you're going to want to build your marketing platform. Websites are fairly inexpensive to build. There are lots of user-friendly site builders that you can use. Wix, W-I-X, is one that several people use. Bluehost is another. You can get a website name through GoDaddy for about $10. And web hosting can be inexpensive. I think my web hosting is less than $100 a year to establish your website. It is to your benefit to have a website that you can then include in your profile, on all of your socials, on um, any of your documentation, your business agreements, your service agreements. You can always include your website on there. Be sure to list yourself in any available directories. There are many websites that have directories. Doula Match is one that comes highly recommended. You can go to doulamatch.com. They are a donation-based site, but you can establish an account for free. And if you establish an account for free with Doula Match, you can upload your credentialing. So you can take pictures of your certification, of additional trainings that you've had, and include that as part of your profile. Write a profile about yourself and update your calendar. Insider tip, on Doula Match and the other directories that use a calendar, the people who have updated their calendars most recently get bumped to the top of the directory line and appear first in the search results. So put a note on your calendar to go update your calendar at least once a week so that you stay fresh in those search results. When you are building your website and when you are determining your business name, the best advice I've ever heard, and that which I pass along to you, consider what people are going to Google when they are looking for you. Because fuzzy wuzzy bitty babies might sound very cute, but nobody is very likely Googling fuzzy wuzzy bitty babies. So if people are choosing to name their business after pet names that they call their children, after things that sound euphonious to the ear, they may not be what people are looking up. So consider that. What are people Googling? What search terms are they using? And don't use them in just your business name, use them in your website and use them all over your website so that in keyword searches, your SEO is optimized and you get better Google results. And social media. Let's talk about building your social media platform. You can create a business account on all of the socials, on Facebook, on Insta, on TikTok. It's a great way to promote your business and it's a great way to get engagement. But if you are only using your socials to promote your business, you are likely not going to see much business growth because the key to growing business through socials is interaction. So posting things that are about your business is only one very small piece of the much larger puzzle. Percentage-wise, only about every 1 in 5 posts should be promoting your business or anything to do with your business. So maybe you have one post about a workshop that you've got coming up in 3 weeks. You're going to teach a childbirth class. You're going to teach a session on baby wearing. So you're going to put it out on your socials. I'm teaching this session on baby wearing. But if all you post for the next 3 weeks is come to my baby wearing workshop, you're going to lose people because it's not interactive. It's not engaging. So one post, come to my baby wearing workshop. Your next 4 posts need to be about drumming up engagement. So what is going to be of interest to people who would come to your baby wearing workshop? Well, people who would come to a baby wearing workshop are probably either already pregnant, or they already have a baby, or they already have other young children and they want to learn baby wearing so that they can have a little more hands-free time. What is a parent of very small children going to be interested in? Well, where are you located? Where's your class happening? Is it in person? If it's in person and it's in Deptford, what else is going on in Deptford that parents of young children might be interested in? Well, Fasola Park just had a trunk or treat, so I might put something about Fasola Park's trunk or treat on my Facebook page and say, are you taking your little ones trunk or treating this year? Let me know how it goes. Or I want to see your baby's Halloween costume. Post them here and let me be the proud auntie, right? Or how did you celebrate your baby's first birthday? How will you celebrate your baby's first birthday? Or what is the baby going to call your parents? Or what did you do to get your dog adjusted to your baby after you brought them home? Or here are 5 easy snack ideas for a toddler. And these are the posts that you want to be putting out, things that invite a response, things that are involving and inclusive, and then consider your outreach. Use your hashtags wisely. If you're going to promote something on social media, post number one, information about your baby wearing workshop, link in the comments. Use your first comment on it, love the post, comment on it, and in your first comment, put a link to the event where people can register, make it easy, and then all the hashtags, hashtag Deptford, New Jersey, hashtag baby on the way, hashtag due in March, all of the hashtags that might be relevant to the event that you're having or to the clientele that you're looking to seek, and then invite the engagement. Now, search for the hashtags you just used. Hashtag pregnant in New Jersey. Go to the first 10 people that come up and comment on the post where they used that. Hashtag due in March. Oh, your maternity shoot was so cute. I really hope you have a great birth. Oh, congratulations. Hope to see you at an event sometime. Reach out to people and create human connections, because this is what's going to build your business. If you want to build a thriving business, relationship-based practice is the way to go. It's only a little bit of time spent on your website and only minimal time spent promoting your events, and 80% of the time and 80% of your posts, getting people active, getting people involved, engaged, and included. This is how to use social media to build your practice. Likewise, use it for your networking. Join your doula groups. Join your networking groups. Join the Pregnant in New Jersey groups. But here's the thing about the Pregnant in New Jersey groups. Sometimes it happens that one person will say, "Hi, I'm pregnant in New Jersey and I'm looking for a doula." And 30 doulas are going to come out of the woodwork and say, "I'm a doula, I'm a doula, I'm a doula, I'm a doula. Here's my website, here's my website, here's my website." And it feels to a new parent like swimming in a shark tank. Don't do that, but encourage clients who've had a good experience with you to tag you. Let your reputation speak for you. Let your clients speak to their satisfactory experience, and that's going to get the call far more than "I'm a doula, call me" ever will. Next slide, please. Building your network. Consider your horizontal marketing and your vertical marketing. What do we mean by horizontal and vertical marketing? Your horizontal marketing, these are the people who are doing the same work that you're doing. These are the people in the same community, in the same field. They are your colleague doulas, your colleague childbirth educators, the people you're going to meet at doula networking events, the people you're going to encounter at workshops you might take. Why is this important? One, it builds a support network for yourself. And if you are going to create a sustainable practice as a doula, having a support network is not optional. It is absolutely essential. It is absolutely necessary. Your horizontal network is also going to be who you can reach out to refer to when you are fully booked, and perhaps they'll do the same for you, who you can network with for backup, who you can network with for who might have complementary services that can also work with the same clients that you serve, that might enrich your practice to be able to refer to. Your vertical networking, this is not your outreach, this is your upreach. Who has more outreach to pregnant people than you do, who is not doing the same work that you are already doing? Do you have a chiropractor near you who specializes in prenatal care? Do you have prenatal yoga classes happening near you? Are there childbirth classes happening at your library or your community center? Are there events happening in local faith communities that maybe have outreach to parents-to-be that you do not have? That's your vertical networking. Connect with the OBGYN practices that you've had good experiences with. Tell them you've had good experiences with them. Never underestimate the power of a thank you note. If you go to a birth or you go to a prenatal visit and you have a good experience with somebody's provider, tell them so. Don't just tell your client, Tell the provider, send a thank you note, a handwritten thank you note if you can, but an email is also okay, to say, I so enjoyed meeting you at Rebecca Jones's birth, and I can't wait until I see you again. I'm looking forward to sending other clients to your practice. If you had a hospital nurse who gave your client a good experience, don't just tell the nurse, tell their boss. Call patient relations and ask how you can pass along kudos for an experience with a staff person that you had. They'll probably give you an email. You can email that person's manager, their nurse manager, their hospital manager, and say, Kathy was such a great nurse for us. She supported my client in position changes and helped her have the unmedicated birth she really wished to have. That's going to go in this employee's permanent file. And they might not be able to do anything in reciprocity in that moment, but the next time you come into that hospital, Kathy's going to remember who you are. And she's probably told some colleagues about you too. Oh, I had a doula that was really good. And this is part of building your relationship practice. Reach out to the OBs you have a good experience with. I talk all the time about how when my daughter was younger, on Take Your Daughter to Work Day, we would do doulas and donuts. We would go to the local bakery. We would get 5 dozen boxes of donuts. I would tape my business card and a thank you note to each box of donuts, and we would drive around the city to the OBs that I worked with most often and come in and greet their receptionist and say, oh, hey, taking my daughter to work. It's Doulas and Donuts Day. I just wanted to drop these off with a couple of my brochures and say thank y'all for all the business you've sent this way sent my way this year. Great to see you. And be on your way. They're going to remember. And those business cards are going to get passed along. The next time a client asks, the next time their patient asks, hey, is there a doula you like? They're going to remember the doula that brought them donuts. They're going to remember the name of the person who made the point of checking in with them. They're going to remember the name of the person who sent them the thank you note, or of the person who reached out to them to establish a relationship. Next slide, please. So we talked a little bit about building your business, but I'll review that. You can register your business name. That link is in the chat. We'll drop it in again for those of you who just popped in. You can both search for a business name and register a business name. And I will pop those right here. You can start an LLC. You can call an accountant to do that, or there are DIY services online. You can do it yourself without a service, but I like to use a service to make sure that all the I's get dotted and T's get crossed. You also have the option of joining as a doula in an agency or in a group. You do not have to establish your own practice. You may, but you don't have to. If you do choose to work for an agency, there are a few things to find out. One, do they expect you to have your own business established? Because some agencies subcontract. That means that they are not employers, they do not withhold for your taxes, and they do not reimburse for your expenses. They simply charge a membership fee and send out referrals. Know whether that's true of your agency or not. If you do have an agency that employs, find out what percentage of their service fees go to the doula, because some agencies have very low fees, 20%. Some agencies have very high fees, 40%, 50%, or more. Some agencies permit doulas to also have a private practice outside of the referrals from their agency, and some agencies do not. Read your service agreement very, very carefully and see if they have a do not compete clause. If you sign a do not compete agreement, it means that you will only take on clients that that agency has referred to you. If other clients call you, you must refer them to the agency to pay you so that the agency gets their cut, even if it was an external client. And some agencies in their do not compete clause have language that says that if you quit, you will wait 2 years before you will advertise for your private practice in their service area. So be very mindful and very careful to read all of the fine print when joining a group. Next slide, please. And to build sustainably, we've already said you need a support network, and this is why you want to do your horizontal networking. And let me say, this is the time to join the New Jersey Doula Learning Collaborative. We are here for community support. We are community by doulas for doulas. We are in this together. We have quarterly hub meetings in North Jersey, in Central Jersey, in South Jersey. Some of our community partners have continuing education meetings once a month that our doula community at large is invited to. Watch our socials. You will see those. The CDOSJ, Community Doulas of South Jersey, Doulas and Desserts events in Central and South Jersey happen quarterly. Come. Doulas and Desserts is just a chance for us to get together in person and sit down and talk with doulas about doula things that have worked well with your business, things that you've learned, things that you've read. Who are you following? What are you interested in? Did you have an experience you want to talk about? That's what the DLC is here for. And we are a source of support when it comes to enrolling in New Jersey family care. I'm going to say this on every call. We need 3,000 full-time doulas to cover the births that are covered by New Jersey family care. We have less than 100. We need all the doulas. We need everybody in, and we need everybody building sustainably. And that's why we're doing it together, because we've got to. So come, stay in touch with us. Keep coming to our lunch and learns. Keep coming to our social events. Be involved in our work groups. If you have not signed up to be active with an NJDLC work group, we would love for you to do that. We can also put, we have links that go out for that from time to time. And of course, you can always contact us by email, njdlc@healthconnect1.org. We'll put that in the chat as well. You can find us online, njdlc.org. We do also have a North Jersey Doulas and Desserts, which happens with the Montclair Women's Group, I think is our co-host on that one. I don't want to misspeak, but that's happening in North Jersey. And we have quarterly live fee-for-service enrollment support events. Fee-for-service enrollment is the very first step in enrolling in New Jersey family care. Once you have all of your application pieces together, and if you're not sure what those are, you can contact us. We'll help you get them together. Then you can come to our fee-for-service application events. They happen virtually online, and they happen live and in person in Camden, in Montclair, and in Trenton in our office. And we invite you to come, sit with us one-on-one. A member of the NJDLC team will sit down with you and help you get that application done so that you know that it's done well and it will be processed in a timely way, and we will get you enrolled. You can also outreach us during office hours. We are online every Monday from 11:30 to 1:30 and every Wednesday from 1 to 3. So right after this call, we do have office hours. You can find the link on our website on njdlc.org. If you have any kind of doula questions, you have any kind of enrollment support, you have any kind of technical questions, or if you just want to talk to a doula about a thing that's going on that you haven't been through before, I'm on there. Katya's on there, Danya's on there, Tamaya's on there. We're here for you. Please call us. And I believe, next slide, that's our last one. Let's talk about it. But before we start everybody talking together, thank you for being on the call today. And feel free to outreach us at any time. Follow us online if you haven't already. Come to our next Lunch and Learn. We'll see you soon. And we are okay to stop recording.